Hello, this is Dr. Bill Tenpass, and we're here to talk about children's dental health. Children's dental health is a myriad of issues, and I think we'll just discuss a few of them today. First of all, let's talk a little bit about when your child first should see the dentist the first time. And that should be around anywhere from 6 months to a year, when you first see the child's teeth. Now, oftentimes people feel that in order to take care of a child's teeth, they need to brush them. Not true. If a child's first teeth come in, the best thing to do is take a wet washcloth and gently wash around those teeth with that washcloth. Later, use a brush. Also, another thing is when you send your child to bed, please don't send your child to bed with anything in a bottle but water. Also, it's very important that we know that a parent realizes that decay is a communicable disease. In other words, the bacteria that causes decay is usually passed from parent to child. So be very careful when you're tasting your child's food before you put it in their mouth, or if a binky falls and you clean it off, or the issue with simply kissing a baby on the mouth. All those things transfer bacteria to the baby and are preceptors to decay in the baby's mouth. I think the next thing we've got to look at is foods that children eat. First of all, sticky sweet foods are not good. So what we should do is we should always deter from that. If they take those things such as peanut butter and jelly, dried fruit, or soda pop, that afterwards they rinse their mouth gently with regular water and get rid of that sugar that causes acids to form and then demineralizes the teeth. Children that have phobias going to the dentist, it's very important that they go to the dentist without having any expectations of them. Such things as having them sit in the chair when a parent has an appointment, or going and watching their parent have an appointment, and then they should be more cognizant of what goes on around them. Sticking a child in a chair and asking them to perform is unrealistic and often traumatizing to that child, and it then tells the child from then on that that type of thing is scary. So we've got to hit that early when we can. I think the last thing I would say is that children need parents' supervision when you brush their teeth. In other words, until a child develops small motor muscle activation, in other words, when they learn to cursive write or something like that, it's important that the parent help that child clean their teeth. Oftentimes what we did with our children is we put their head in our laps when we put them to bed and just brushed their teeth as we talked with them or as somebody read to them. It became part of the routine, and they then realized that they needed to brush their teeth after breakfast and before they went to bed at night, which are the two times when the bacteria is at longest at work in their mouth. So we rid the bacteria during those times. I hope this helps, and if there's anything else we can do, please don't hesitate to call me or ODS, and we'll be happy to give you any indication of what the latest research is or how we can help you with your children's dental health.